It's 3:30. I was going to say 9 o'clock. It's 3:30 in the afternoon. I call the meeting to order for the Price County Health and Human Services meeting. I'm Paula Hodek and I chair the committee. And Jean is on vacation, so I'm going to take roll. All right, Joe Baratka, Paula Hodek here, Robert Kopesh, Patricia Steffen.
Here.
Stephen, I'm sorry, Dennis Wartko, Peter Daly, Sally Hummel, Susie Ocker. And Gerald, I think, said he was going to be absent, so he's excused. All right. You put that on way over there. Thank you. All right. So for anyone who's online, if you don't realize that we start the meeting at 3:30 today because we do an annual public participation and that will start at 5 o'clock. So we're going to make sure that we can get through all of this. If there's time at the end that we have to wait, we'll just be sitting here and wait till 5 o'clock because that's when it's posted. All right, now, so public comment. Do we have anybody online, Nick? That's not,
*6 if you're here for public comment online. We do have one individual online, but
okay,
I don't believe they're here for public comment.
okay. Any communication from the board? All right, let's move on. New employee introduction. Cheyenne, I believe you are going to take the helm on that one.
Yes, so from the Aging and Disability Resource Center and APS unit, we have a new social worker, Jordan Kutsky. So she will be doing the APS side of things, guardianships, protective placements, and then investigations.
Okay, welcome here, Jordan. Okay, thank you. The vouchers went around. Were they all signed by everyone, or is Mr. Kopish still looking at them? They're already finished? Just one batch that I had, yep. Okay, so since your last,
Oh, I gave them the jewels, so
okay, so we need a motion to approve. Mr. Wardgo and second for Mr. Brodka. Is there any discussion for that at this point? Everybody looks at, yes, this is the time to ask questions.
Is now the time?
Yes, it is.
We have a lot of time today, right?
At all?
You can talk as slow as you want.
Okay, then. There's several items in here that's for Jay's Automotive. That's
Yes,
described as mileage allocation or
that
miles,
is
meals, and lodging.
for repair for the aging vehicle. What do we have done with that?
Shouldn't there be a category for repair?
Okay. So it was towing expense, so we put that off to our aging allocation or our mileage allocation.
What kind of expense?
A flat tire and it had to be towed. So that we put that off to our aging vehicle.
All of these are flat tires?
Oh, it was one incident, but we had to split it up between the different departments that
There's
use
one here
the
for
aging vehicle.
$587.10.
Children and youth used the majority of it. I don't know, the bill was 800 and some
Oh,
dollars because we got new tires also. So
should
it was
that go into
expensive.
mileage though? Shouldn't it be in car repair or maintenance or something?
Do we have a line item for that?
Just a question.
Yeah.
You guys can deal with it.
We've
Just thought
always,
I'd
I guess we put it
bring
to
it
the,
up because we
mileage
have a
account would
lot
be-
of time.
I don't think we have
Oh.
a,
And it was up in Butternut too, wasn't it?
we can make a maintenance one.
Mhm.
It's
Then I had another question on Nelson Defense Group for $13,000. Is that a covert operation or?
no. I could tell you, but no. That's,
But you'd have to shoot me. right?
Yeah. that's for children and youth.
Youth for an attorney.
Oh, that's an attorney, legal fees, okay. And then there's a petty cashier for $300 for Sarah for donations. No, that's kind of fishy.
It is.
Yeah. That is the Moose. It's kind
Moose
of
Lodge.
Moose Lodge. So what they do is they write a check. And so for $300 for camp. Is that correct, Kayla?
That one was for the rodeo.
Oh,
or
that for the
fair, right?
rodeo.
Yeah,
Through our TO.
Oh, okay.
So that was a donation from them, and then they wrote the check to me, and then
because we had to divvy it out between several kids and that kind of thing. So
no pocketed.
And
we got receipts and proof of everything.
Yeah.
I would hope so. Yeah. I know if that was my name for petty cash, there'd be all that kind of stuff going on. Yeah. Okay, that's it.
Okay.
Thank you.
For a couple other questions that we had, if you want to just. bring
Yeah,
those up.
on I forget what page it was on the committee reports, but there was a number of payments all in a row for Angela O'Neill, and she's a kinship provider. And we had a lot of she was a kinship provider that was just licensed, so we had some back payments that were due her for May, June, and July. So that's why her name is there several times. She was paid for May, paid for June, and then partial payment for May, and then all of June and all of July, and it was for two different kids. So that's why her name is showing up there several times. The system generates, the state and their WSACA's program generates those payments, so we don't have control how they show in their system, but that's why it's in there multiple times. And then your question was answered about the little bitty charges for Amazon. Okay,
Yeah, the 49 cents.
Yep,
and
that's just
25
because we
cents and different accounts, different.
divvy it up
places
between
go.
all the departments we have. Yeah,
Thank you.
you're welcome.
Boy, that was a busy time for you. Any other questions for Chris Ann? All right, thank you very much.
Welcome.
So all those in favor of the motion to accept the vouchers as presented? We have a motion and a second.
Aye.
Everyone, all those in favor? Aye. Those opposed? All right, motion's carried. We don't have Jean here to snap that whip here yet. Jules hasn't gotten that far yet. All right, the minutes. Do we have the minutes in front of us? I have the minutes that you gave me last when I reported to the county board, Jules, but I don't think they came to us yet from Jean. No, okay, so we will put those aside till next month. Okay. Next on the agenda, we have the 2023 annual report. I'll let Sarah take over on that, just so you know, there's no motion for this. This is just an FYI and it goes into the file.
What I did was I asked the supervisors here for this here report. And report, it was given out last August, and so I'd asked that everybody got an opportunity to review it. And so I asked the supervisors to come in, and just in case you had a question, they could answer in regards to stats. So the first the first group, it would be the fiscal and the admin. I was wondering if anybody had any questions in regards to the fiscal and the admin portion. Okay. Behavioral health.
Sally, do you have a copy of this? Yeah, do you have it with you? Oh, okay. Do you have another, anyone need a copy to look at? I don't know if there were extras in the office. Okay.
That's okay. Next would, okay. Next would be behavioral health. Any questions in regards to behavioral health stats? Economic support. Questions? I bet nobody has one of these. Public health. Be the next. Aging and disability unit. Whoops. Senior services. And children and youth. Okay, so there's no questions. we'll have this one. I know Michelle has to have it for hers for the, right?
To send it to the state.
Okay,
It does go up.
So do you need a motion for it then?
We don't need a motion, they just need to know that we did it. So
That-
they just have to-
Okay, so it's on the agenda. Okay,
I'll send them a copy.
okay. So I was going to say, for anyone who just has questions about what goes on in the Health and Human Services, this is a good reference to keep handy at home for yourself or wherever. So if someone does call for any questions about what's going on, you can at least refer to that and you want to know what each of those departments handles. It's very good. It's very well laid out. So thank you. All right, like I said, that's just an FYI. Subcommittee appointments. We have been beating this for a long time. Mr. Kopish, did you come up with any names? No. Well, we do have Council on Aging on Monday, so we'll have to discuss where we'll go from there. Where do we go from here, boys? Where do we go?
So,
Yes,
so you were saying that we've met all the requirements as far as the age requirements being on the committee, and we're just looking for someone from the north, not necessarily age requirement or whether they're county board or citizen. Is that correct?
correct.
I would throw my name on it if you can't find anybody else to have a northern representative.
Oh, okay. That's a good call. So I'll take that back to Council on Aging.
You said 4 times a year they meet?
Yeah, quarterly. Mhm.
Okay.
Mhm.
Yep. Okay.
And we meet at the different nutrition sites.
Mhm.
So
Yeah.
this Monday is at Kennan and it's
Monday.
at 10:30.
Okay.
So if you wanted to come there,
I'll check my schedule.
Yep,
And
okay.
Like it says, being just starting out, I'll have to work this into my schedule. So when we have
Sure.
the meetings, I'll definitely be there. But
sure.
this first one, I'll see. But I think I can make that
Okay.
one.
Mr. Kopesh, I'm going to deflect this to you. Do you see it as a problem as a committee member being a northern rep or a representative at all?
If there's nothing if there's
I-
bylaws or whatever that says you can't.
Well, I know I represent the county on there, so he would just be a northern
You'd
rep
just be a
then.
northern rep, yeah.
I don't know anything about that. That topic hasn't come up, that question, so we can defer that to Jean when she gets back or.
I think it would be good for Joe as he's entering that part of his life,
What do you mean, public service? Or are you
Oh,
referring to
That-
something,
that's what
are
I
you
meant.
referring to something else?
A little,
Referring to that gray hair that's.
The majority of it came from that individual.
oh, I'm glad you're on either side of the room here.
I think that's a compliment. Yeah, that's what I thought.
So that would be great, Joe, if you could do that. Yeah. So 4 times a year, if you can work that out, that'd be awesome. All right. Don't you think so, Chris? Yeah. All right, good. I really, 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 really wanted to get somebody from the north representing us, rather than just somebody else, because it just makes it so much easier to present to people. So thank
And
you, Joe.
One other thing, just to make sure, Nick, that is I am from the north, correct? Being Flambeau and part of Lake.
Close
I
enough
believe
to the
that puts
north.
me in the
yeah.
north. Okay. Just making sure that I'm not volunteering for something that I shouldn't be. So.
Well,
No,
Mark
we had
Kyle-
discussed that opening it up to more
Right.
area, but I would north.
Because if you look at it on as highway, I'm considered north
Mhm.
or at large. So that's why I assumed that it would be a
Yeah.
north. rep.
The only thing I would double check is creating a negative quorum of another committee and or a committee quorum, because you'd be both. Here, we wouldn't have a problem because there's more members. Are you on any other committees together?
No.
Yeah,
A
highway.
highway.
I think you're okay though, because it's negative. I mean, you're
Would
not
you look into
discussing
that for
highways.
us, Nick?
We'll look at it.
Thank you.
I don't believe it'll be an issue, but let me double check.
Well, I know when I first was on Council on Aging, we couldn't get anybody to volunteer to be the vice chair. So they asked me, I said, sure. But then Bob Kopish slapped my hand and said, can't do that as a county board member because we're dealing with monies, right?
I don't remember that incident, but I'll
I do.
I'll go
There's
along.
quite a bruise here
Is it
yet.
still bruised?
Yeah.
Sorry about that.
All right, we'll move on with that. Make a question. Public Health Division, Michelle. Come on up. Michelle Edwards is here.
So I hope you all received a copy of the community health assessment. It was a multi-page, and then there's just a short one-pager. So if you recall, when we talk about our community needs assessment, doing that every 3 years with the hospital, and then develop our community needs plan. I'm bringing today our community needs assessment. So this will be our new assessment portion. So I just wanted you to be aware of, this is what came out of our surveys that we did, our stakeholder meetings, and this is kind of putting it all down in one place. So you can see our process of doing the assessment and what we've come up with to take to the coalitions and help develop our plan. So our plan should hopefully be here by December. And then in January, we'll be starting the new community needs plan. So this year we did it, or this cycle, we did it a little bit different, and we have the full assessment, but then we put together just a brief one-pager that might be a little bit quicker and easier for people. I don't know if it's easier to see, the back page has got a lot of information on it, but it's just a kind of condensed version. And so this is maybe a little bit easier for community to just read this if they don't want to read the whole assessment report. So I'm just bringing that to you for your information. If you had a chance to review it and you have questions on anything, I can try to answer it. Or if you feel like we didn't put something in there quite right, we can still change this.
Just a question on the numbers here on the front page. The disabled population is 17.1%. Where does that put us statewide or on a broader scale?
This came from the Census Bureau webpage. I brought Tiff with me, who put this all together as my backup.
That sounds like a high
So-
number, but maybe it's not.
It sounds like a what?
That sounds like a high number, but maybe it's not.
I don't know where it is with the rest of, if it had a comparison for the rest of the state, or if it's just here's Price County's information.
Okay.
You want
We
to
can look back. at the
clarify
site.
too, like when it says disabled population, I think there's a thought or an idea of what disabled looks like and what actually is probably represented in this number. Because we had this conversation at my administrators group where it was like, whoa, we're all 20% of our communities listed here, when that's not the image, right? Is
Mhm.
the level. So do you want to talk about that maybe?
If I knew how to answer it, I would, but I don't know how they
I'm thinking
got this
right.
number.
But I
So
think
I'd
when,
have to look back at
when we
that
hear
site.
disabled population, we think people in wheelchairs or people who are non-mobile. So
And
it's
it could
like,
be
oh,
blind,
20%, yeah.
deaf,
Or it could just be you have your hard of hearing. Could be, I don't know what they
as a
counted.
disability. Do you
Yeah.
remember what it had for that?
Right, the whole room's got no. Yeah. So
What?
yeah, huh? Huh? I can't see who's talking. Who's talking over there?
Michelle, does mental health include in this?
I would have to look at what the reference is on that Census Bureau and see exactly what that is. I mean, they're all referenced in the back of this, that it's at the, from the Census Bureau site. So I can look back at it and see what it is. But yes, I mean, it includes more than just they're in a wheelchair and they can't move. Whether it's mental health kind of disability or all those that get some sort of a disability,
The
I
number
don't,
of
I'm not sure.
placards in people's cars, does that count?
I would say it has to be something that lasts more than a year. It can't just be they had a broken leg and got their sticker.
I was trying to find what I sent to you this morning from the
Oh.
WRS News.
Mhm.
I must have deleted it already. Do you remember what?
That was.
It seemed to
was
pick
that
up all of the.
yesterday or today. Yeah, that I put or I went in and got the Price County one. You
Mhm.
can pull that. Then that's just for the 65 and older though.
Right.
So that wouldn't have had our whole population if we have,
No, but
disabled.
it still hit on all of those areas that we found it with that survey.
Oh, yeah. So you're talking kind of different subject. I mean, broader.
Right.
Than just
what
this
that had.
part.
If any of you get
Yeah.
your WRS news, in there was a just kind of a small thing, but it had us in there, and they had us not. Sorry, I don't have it here. I must have gotten rid of it. But it was really good because it showed that we as Price County, we were like middle of like high, and some were very, very low for this range. And I'm going to probably send it out to you. I'll have Jean send it to you. It just was just
That
real
one was the
interesting.
social isolation, that map
Mhm.
that they showed that had Price specifically was comparing for like social isolation of a person over 65. But you could go into it. It was the America's Health Rankings, I
Mhm.
think is the name of the report. And when you looked at it, they broke it down kind of like this, the county health rankings. You know how we showed the clinical care, behavioral factors, all those different physical environment, how they broke it down into the different social determinants of health. And they did this same type of breakdown, but just with the population of the 65 and older. And then it had ranked, I guess it was just Wisconsin. It wasn't Price County. It had ranked Wisconsin among the other states. And it was kind of interesting on a good note, like Wisconsin were ranked number 1 for the number of 65 and older who are physically active.
Mhm.
So they had some, good parts. But then when you looked at where we ranked lower, I just looked at like if we ranked 30 or higher, and it was all things that came up in our stakeholder meeting, even for Price County, like the broadband internet issue was one, cost of housing, access to care, the geriatric clinicians, excessive alcohol use, and obesity was on there. It was like all the ones that kind of came out in our own assessment is what showed for the 65 and older for the state of Wisconsin when it's ranked among the other states. So I found that kind of interesting that,
Too. Yeah.
yeah, we're kind of spot on with what we think, I guess, and what the community is saying too in their surveys.
I'll see if I didn't throw that pamphlet away already, or that.
I still have it on my email.
do.
if
Okay, maybe you
yep,
could share it with everyone.
Yep.
Okay.
Yep.
It's just a interesting thing, kind of piggybacks off of what you're talking about.
Mhm.
So. Any questions for Michelle, or anything more you wanted to say about this?
Are you thinking this should be more detail, or this is just a quick snapshot of kind of what Price County looks like, and then it is referenced, but if you need or think I think all data could be explained to the help for people to understand all of it, but we tried to, when we broke them down, we put, some of our survey results versus some of then the secondary result data, so that people kind of had an idea of what we were going off of to make our decision on our priorities. And then our strengths that we have also.
The counties that close us around us, just.
Mhm.
Sally, use the microphone, please.
That you.
We just want to hear what you have to say, but we're not.
Okay, I was just saying, could we have some other counties that are within our area that we could just see how we're doing in our upper north?
Mhm.
It would be good to see.
So it does do that. I mean, this is just our assessment for Price County. So it's just kind of to show what we gathered from our surveys and what areas we want to work on. you can look specifically like the county health rankings if you want something that you want to look at, like how does our obesity rate compare to Sawyer County and Taylor County and the ones around us. You can plug in the counties in that website and it will compare the different things. So there's resources we could go to get that. I don't know how to necessarily put it in our report, but there is the capability to do that for some of the data. If that kind of answers. Okay.
Any questions for Michelle on that? Thoughts?
This is one of the things we have to do for the state. This is a mandatory requirement that we do the community needs assessment and come up with a plan. So that too is one of the reasons I'm bringing it to you.
Does this need a motion for you to have this? Okay.
No.
Well, I know there was a few things that we had to do for you to prove that, but okay.
You just have to prove it's on there. You're aware of it.
Yep.
We're not, we're doing it.
All right. How about the COVID booster update?
Yeah, I thought maybe I would just give you a quick update of what I know as far as the COVID vaccine. They did approve a 24-25 version. So much like influenza, how the strain changes every year and they come up with a new one. That's what's happening with COVID. So the last booster that we got, we are no longer able to give that one. So the only vaccine that would be available for COVID is the new 24-25 booster dose. We, Moderna, where we get ours, is not sending it out until mid-September. So we won't be getting ours until a little later. But again, you can get it at the same time that you get influenza vaccine. They don't combine them into one poke. They're two separate pokes, but you can get them at the same time. There's nothing wrong with that. One is all you need. There's nothing, even if you've never had any COVID vaccine in the past, it's just this one vaccine is what you need unless you're under the age of 5. Then you would get 2.
Will the local pharmacies carry this as well?
I have not heard. Park Pharmacy did in the past.
Okay.
Lakeview was not carrying it before. So, and I was going to call it COPS, Pick and Save, whatever. They've had it in the past, so I have not heard yet who's
Okay.
all carrying it.
Okay. So
So,
I'm sure you'll let the public know when they come out?
yes,
or-
yep.
okay.
When we have it, then we will start, advertising that more, that we have it available and
Will
when
you
they
be
can get
looking
it.
at walk-ins or call-in for
We
appointments?
do, yes. They can call at any time and set up an appointment once we have them.
Okay.
We have our flu clinics. We are just finalizing the dates for that. We did decide that we were not going to travel with the vaccine because it can only be out of the refrigerator for so long and it can only be out of the freezer. I mean, if we keep it in the freezer, it lasts for months. Once we take it out, we only have it for 1 month. So I don't want to take a bunch with us and then we don't go through it and then we're kind of stuck because it's all private pay now. So
Kind of.
we're out that, yeah. So it's really based on appointments for that. I think we did offer it with one of the businesses that we go in and do flu clinics for. So they would sign up ahead of time. So then we would know how much we have to bring with. And so we are going to offer it at one of our business ones because they sign up ahead of time.
Okay.
So yeah, we're looking at that.
Any questions for Michelle? Okay. Thank you.
Thanks.
Aging and Disability and Senior Services Division, Cheyenne and Chris. We have, or the Transportation Coordinating Committee. Patty, do you have something on that?
Nothing major. Go ahead. We're almost a trouble-free committee.
Right. So the TCC met on August 19th. Some of the updates were requests were made for to both Park Falls and Phillips for $12,500 for 2025 for the BART bus,
Okay.
to continue the services there. Ridership continues to increase. They saw record levels in July.
Oh, nice.
Minocqua route is, Saturday route is not getting a lot of use. They got good response for the free rides for veterans. They'll reevaluate that at the end of the year. They also did free youth rides for the summer. The budget for 2025 is in progress, and the electric bus is anticipated in 2026 for BART. Next meeting is November 18th.
Any questions for Chris? All right. ADRC of the North Governing Board. I was at the meeting online, and so was Cheyenne. Cheyenne, go for it.
So this is my first update for these different boards, so I'm not sure how in-depth I'm supposed to go, but we'll do it anyway. So for the ADRCN Governing Board, that was on August 27th. They talked a good deal about Peer Place, which is starting in November. That's a new reporting system across the ADRC, so that'll be a big change. Discussed the 2025 scope of services. A lot of what's changed there is just simple wording for things, not a lot of policy change. There is a new residency manual, the first time it's been updated since 2012. And so now it will be more the same across all programs. So in the past, residency has been a little bit different for ADRC versus APS, and now it's going to be more streamlined, which will be helpful. EBS funding is changing a bit. So that's the Elder Benefits Specialist Program. The funding is changing for the program attorneys for that program, not the county position specifically. ADRC was looking at rebranding. So there were a couple of options that were discussed initially. It looks like they are going to just do a slight color change in the logo, and then we will be able to use the current products that we have and then rebrand once those products are gone. So we'll save a lot of money that way. There will be a survey coming out, well, so it has already, August, September, October, and November, a random survey for any consumers who have gone through options counseling at the ADRC. So they'll get a survey just asking about their experience with that. Tribal updates, there is no representation on the ADRC governing board for tribal. So that was something that we discussed kind of at length. And then we discussed a no quorum as well. I know Paula had brought that up. I don't know if you want to speak to that at all.
I did. Actually, I had some notes here. So I'm glad, nice report, by the way.
Thank you.
Yeah. So I was very concerned by us not having a quorum. I was not, to say the least, I wasn't really happy. We started late again, and which is really troubling for all of us who try to get there on time and log in and do what we need to do. So I might talk to Natasha about that a little bit. But another thing that concerned me is we had a no quorum, and so we couldn't do some things that required voting. And I noticed on my agenda that it had our Price County Citizen in parentheses. It said vacant. And I wanted to know why it was vacant, because I knew at this meeting we had, and then at the county board, we had approved Kathy Shimkitz, because Kathy's comment to me when I did contact her, whether she was interested or not, was, sure, I'll do it unless somebody else wants to do that. So she is definitely on there. So that was, as Natasha said, that she runs the ADRC of North. So she said, oh, I guess I missed her. So, you know, those kinds of things are troubling to me, that these are happening. And then I also had a question to what Cheyenne was saying, is that We don't have any representation from any of the tribal communities. We don't have LCO, we don't have Bad River, and we don't have Red Cliff. And as long as I've sat on there, and that's several terms now, we haven't had anybody. So my question to them was, what are we doing about it? Are you meeting with the tribes? Are you discussing with them? Is it not something that she's comfortable doing? And is there someone who could go and talk with the tribal communities? Because I just feel, again, just like us not having a northern rep on COA, we should have an input from what they're saying. If they're getting services, what's happening there? So again, there was kind of not real sure about what was going on there. Now Ashland County Board has an opening for their ADRC, so we were missing that person. Just a few things that just make me go, and I just wanted to ask those questions. So I did. So we'll see how that goes. So those were the questions that I had brought.
And so for the Woodlands Consortium, that meeting was on August 22nd. A lot of what was discussed was rate setting for 2025. So one-to-one, a person who's requiring someone to sit with them continuously, those rates will go up from $200 to $300 for a full day. A half a day would then be $150. And then they discussed specifically a private room rate going from $20 to $200. That's what I made note of, Paula. I don't know if you have anything else specifically.
You know, if ever I should have thought of you, and I apologize for that. I had sent Brandon a question. Remember, I mentioned that I was hoping he'd get the minutes out right away. Well, yesterday I was sending him a reminder. So I'll make sure that he sends it to you as well, because we do report at our Board of Health, and I'm not sure everyone else does. Let me see. No, I just don't think so. I think you should take the minutes for them. That's very good. Okay. All right. So I said that. All right. Nope. I have nothing else to report. Nice job.
Thank you.
Any other questions for Cheyenne? No? Okay. Thank you. Thank you, Cheyenne. Economic support, Sarah.
Every year for the energy assistance, we need to approve or have the board review this policy. So I believe that you guys have that policy in front of you. This proactive for WEEP. It's no cost to the county. It's a state and federal grant, and it assists households who are losing their home energy source. And below here, it explains the guidelines that they needs to occur before they're able to receive money. And I don't know if you guys got an opportunity to see that, where they have to prove that they have maybe at least paid $25 a month, or they can upfront pay $150 if they're requesting for their fuel assistance. The department can give an exception to the crisis active benefit once to the family. So actually, if it goes over, and if you see in the middle there, if it goes over $1,200, if they're asking, that has to go to the state for approval for more than $1,200. Pardon?
Does everyone have that?
Yeah, everyone should. I should have gone out with. Should have been sent with
The packet.
with this packet. Yeah, with the price count with.
That's the additional
Is it-
information that you sent out today,
Hold on.
because I don't have it either.
Didn't have either because it was sent out. I bet we'd have time if you want. We could make copies, but
Jules, could you? Jules can, oh, now she'll have all your
I
notes
have all
in
my
there.
notes. But that's okay.
Well,
There's
let's
nothing on
see.
there. I just want to make sure. Yes, if you want to make copies of. Yeah.
Sarah, are there any changes?
No.
So basically, it's the same policy we had last time.
Yeah.
I don't know if she sent it over. or not.
It's all. It is in the packet. Yeah.
Is it?
Yeah, it might end up in Michelle's maybe.
Oh, I wonder. In here. Okay.
Yeah, it might be in Michelle's pack.
You know, it looks familiar, but we do it every year.
Yeah,
There it is.
okay, yeah.
Back
so
of
it's-
Michelle's packet, the assessment packet. All right. Thank you, Jules.
So yeah, there's no changes that it's the same process and same amount.
Yeah, we do this every year.
Mhm.
Yep. Give them just a second to look at it.
Yeah,
So you need a motion to approve?
Probably.
do,
You
yes.
do.
Yeah, I'll make that motion.
Mr. Kobesh has made a motion to approve the proactive crisis applications for 24-25. Second with Susie Ocker. Everyone has had a chance to quickly glance through that. If you remember them from years past, they're pretty much the same thing. They are, actually. So I'll call for the vote. All those in favor? Those opposed? Okay, motion's carried. And I need to sign something, don't
I just, up on top, I approve it, but the board approves.
I? Okay,
So,
you just do that. All
Yep.
right. Okay, thank you for that. Thanks for helping to find that, Jules. Let's see. Is Carrie here? Yep, there she is. Carrie does have a handout. Should have been in your mailbox.
Okay. So as we've kind of discussed in our previous meeting, even too with like Kayla's quarterly report, the expenses for the CNY high cost placements have been going up. We do also project that that will continue to go up and that there's a couple things coming down the pipeline. Same with the behavioral health high cost placements. I talked to Chana today too, and there's going to be another placement that you'll start to see hit this report within the next month or two. So it's just one of those years now. Any questions?
And it's always noted that we're 1.5 to 2 months behind.
Mm-hmm. Yeah, so it might even be, I don't know, like 2 to 3 more months before you do start to see some of the things that are happening right now.
And that's not within your control, is it?
No.
No.
It's just our accounting system and just like the billing of everything too. And I mean, especially the behavioral health and those things tend to get a little bit backlogged even from our different contractors and providers. And
Any questions for Carrie?
yeah, I'm not 1.5 to 2 months behind.
Mhm. I mean, we could have her do a song and dance.
Or maybe
here
on some
something.
things, but not that.
All right. All right. Thank you, Carrie. All right, Sarah.
Yeah, I don't know if I can go for 45 minutes here on the director's report.
Good you are.
Yeah, I should probably go really slow.
I can always fill in, Sarah.
Oh, perfect, perfect. Yeah, there we go.
Yes, you can.
The Department of Children and Families Bureau of Regional Operations had their triennial visit with the Children and Youth Unit, which was with Kayla and myself. They went over our organizational updates, challenges, strengths, any challenges and strengths with partnerships, with programming for our targeted safety support funds that we use for clients and are safe and stable. And those are the ones that Nick talks about that's helped us keep out of home placements. They were really impressed on how we really use our funding to help out of home placements. That was one thing that I believe that our county really uses, and we use our funds up. They have found that other counties aren't using them. So we gave them some good ideas to give back to other counties. They went through key performance indicators, and that is for our screening for all intakes that come in. Are we doing them timely? Our initial assessments when we send a worker out, are they going out and making their contacts? Are the attempts timeliness? Blah. Are our reports being done on time? They have only 60 days to do those. Caseworker contacts, when we make placements, we have only 3 days that we need to make contacts and 5 days. And so they make sure, so we were rated really high on that. And then also they reviewed our out-of-home placements and what the length, the stability, are we keeping them in? Are we working, how hard are we working to get them out of home? Or are we having maybe placements put up, having adoptions? So we did really well. One thing is that we are still, from the past, are still working on getting our assessments that when we had that over $1 million placements, we had all those assessments. So we're working on getting them, but it's, we got a really good review. So that was really good to hear.
Nice job.
Yes. We had, we're still looking for an APS social worker too, in children and youth. And today we had an interview for the behavioral health unit. So, so we're still looking for a social worker there, but we are possibly considering offering that position. So, otherwise, that was 45 seconds, maybe. So, any other questions or anything that's possibly going on? That seems to be going pretty well. I know again that our supervisors are definitely doing caseloads, and that's something we really need to search out for workers and have to be creative, and that's what we're trying to be, is creative and trying to fill those positions.
Any problems with school starting up that you see with kids and families?
Yep. First days, few calls. So we're kind of busy. That's as you saw, Kayla said, "Can I go now?" So.
Okay.
Paula?
Yes, Pam.
And
Sorry.
this is a sad question, but what happened in Georgia today? Do we have a place for all the parents to go? Should there be an incident here? On the news, there was a shooting at a high school.
Yeah. School
And
shooting.
the parents are just
That would be something the school would have set
all,
up.
Right, the school, and I probably the law enforcement as well. When I watched it, they did say they were congregating the parents in an area, but I don't know if that was, it looked like maybe the football field area, from what I had seen.
because I was at the school. I don't even know if I remember where to go. And I worked there.
Yeah,
So,
I did too, and I don't recall that either. I just know what we were supposed to do with our students.
yeah.
Run.
Okay, thanks.
Good question.
So in those cases, the school and law enforcement handles that. The county's not involved with that, other than being supportive. If they need support, we're there to help them out.
Right.
Okay. Thanks.
So, like this, at one time, I know Philip had a whole committee.
Mike.
So I know at one time Phillips, that school had a whole committee that had plans of where students were to go, where parents could pick them up. Like the church was one of the places that they would take. So how old that plan is, I'm not sure. And there's been, different administration. So schools, I guess my comment is schools usually will have a plan for where the kids are supposed to go. Some of that FEMA grant that you hear for Phillips to build that gym behind has to do with having a place that you could have people meet. I mean, that's right on the school property. But through our preparedness program, that we have, there's also plans for family assistance. So whether that's the school tragedy or a plane goes down and there's family wondering where their person is, there is plans on how to set up a family assistance shelter and get that out.
And that was always kind of a scary thought for us as teachers because, yep, we had to go to the Methodist church or the Lutheran church or the Baptist church. But I don't know. I always thought if I wouldn't be comfortable to walk out there with kids, I don't know if I was better off in a classroom or not. So I'm glad I don't ever have that. But today was hard to see again on the news. Any other questions for our Health and Human Services? Well, our next meeting is October 9th. And so far for the agenda items I have down, we have the Chippewa Valley Health Cooperative. If you'll remember, that was the letter that our chair, Brian, received from Chippewa Valley Health Cooperative wanting to, how did that go, Sarah? Do you remember that?
Chippewa County Health for.
Cooperative to combine.
Yeah, they
services.
wanted
It
to
was-
meet. I talked to Brian yesterday. They did finally get a hold of him and they said, oh, we can join you by Zoom today, but we had already taken it off the agenda. So they'll be at the next meeting.
Okay.
So Brian's been working with them.
Okay, good. And he said he would call them. And then, so that was what I have. And then I haven't, also Gerald had asked for an update from the playgrounds for the ARPA funds. And then the minutes from August 14th we'll have on there. So if there's anything else that comes up, let me know. Sarah and I are always brainstorming for the agenda items. And
Paula,
yes.
that October 9th meeting, I will not be able to attend.
Oh, you won't.
So
Okay.
put that in your notes.
That meeting's back tonight.
Oh, we always miss you. And will you be here? Yeah.
That's back at 9 o'clock then?
Yes.
Okay.
Yes. This is the only one that we do at the 3:30.
Okay.
And I was telling Sarah as I was driving in, I get this random phone number coming across my phone and I was right at 3 o'clock. I didn't recognize it and I just hit decline on my screen. And then it occurred to me, oh my gosh, did that meeting start at 3? Because I know we went back and forth and I was like, oh my gosh. So I quickly had to scan and see, and it was at 3:30. But let me tell you, my blood pressure probably went up for a few minutes there. Do I drive fast? Oh. All over Emory that I drive fast? Oh. Well,
Lead foot.
no. Anyway, well, Sally, I'll have to chat with you on that one. Jeez.
Not that this isn't enthralling. Do you want to go on a break for?
Yeah, we'll adjourn and then we have to come back into that next meeting, don't we? I have to call that meeting to order.
Oh, okay.
Yeah.
Well, for the online, I was just going to pause it.
Oh, you could pause it. So we'll let the people know that we are going to adjourn this meeting and we will be back on at 5 o'clock for the public participation hearing. And at that time, if we have anybody in the audience, there are 7 or 6 areas where they can speak to. All right. So without any objection, this meeting is adjourned. And we're going to call the meeting to the Price County Health Human Services Board. We have the same board here, so we won't do the roll call. Everyone is still here. No one has left. Notice of the public participation hearing. The Price County Health and Human Services Board will hold an annual public participation meeting to encourage public comment and discussion regarding the scope of services to be provided for 2024. Excuse me. The meeting is open to the public pursuant to the Wisconsin Statutes, Chapter 19, Subchapter V, Open Meeting Law. Members of the public may access all public meetings via conference call. Do we have anybody online? All right. So I'll call the meeting to order. And like I said, roll call has been taken already. Accept public comments regarding planning and budgeting for the following. We have Cheyenne Litvinoff and Chris Maybe for Aging and Disability here. Aging and Disability Resource Centers, Senior Services. Services include but are not limited to information and assistance, long-term care options counseling, functional and financial eligibility for publicly funded long-term care programs, elder and adult at-risk abuse investigations, 2022-2024 aging plan for the elderly, congregate and home-delivered meals, transportation, elderly benefit specialist program, National Family Caregiver Program, Alzheimer's Fair Caregiver Program, Family Caregiver Program, Disease Prevention and Health Promotion Program, Dementia Care Specialist, and others. Number 2, Behavioral Health Division, we have Chana Marakowitz. Services include, but are not limited to, in-home supports, mental health and substance abuse, disabilities services for children, and the Birth to 3 program. Sorry, Chana. Number 3, Children and Youth Division, we have Kayla Borgen here. Programs include, but are not limited to, Children and Family Services, Child Protective Services, and Juvenile Justice. Number 4, Economic Support Division, we have Sarah Soha here. Divisions include, but are not limited to, Food Share and Food Share Employment and Training, Badger Care and related insurance programs, Wisconsin Home Energy Assistance Program, General Assistance. Number 5, Public Health Division, we have Michelle Edwards here. Services include, but are not limited to, communicable diseases, maternal and child health, public health nursing, environmental health, family planning, WIC, women's, infants, and children. And number 6, any other services available to the public through the Health and Human Services Department. Is there anyone here from the public that would like to speak to 1, 2, 3, 4, 5, or 6? Anyone online? No? Okay.
No.
No, thank you. Okay. Hearing and seeing none, without objection, this meeting is now adjourned. What did you say?
Last 5.
Yeah, there you go.
You read fast.